Ms. Brito, you're leaving? Okay. Okay. All the clues that you will need are in the case study, but you're gonna have to know a little bit about the symptomology and the organism and the reservoir. Okay? So the patient was a, what's that?
Are you gonna have this on Blackboard?
No.
So we can look at it?
It's right here. You can take a picture.
Okay.
The patient, well, you're not gonna get this one.
Well, no.
This is
like,
an
just to,
example.
like, see how it
You
is.
see right here, it says example. It's not gonna be this one, because this one's real easy. The patient was a 19-year-old female with a history of urinary tract infection, UTI, 4 months prior to admission, for which she was treated with oral ampicillin without complication. It was resolved. 5 days prior to this admission, she began to note nausea without vomiting. 1 day later, she developed left flank pain, fevers, chills, and noted increased urinary frequency. Right? We just talked about this organism, right?
Mm-hmm.
She noted foul-smelling urine on the day prior to admission. She presented with a temperature of 101.8 Fahrenheit. This was in Celsius. I moved it to Fahrenheit because some of y'all don't like Celsius. Right? And physical examination showed left costal-vertebral angle tenderness. Urinalysis of a clean catch urine sample was notable for greater than 50 white blood cells per high-powered field, 3 to 10 red blood cells per high-powered field, and 3+ bacteria. Urine culture was subsequently positive for greater than 100,000 CFUs of a gram-negative lactose fermenting rod per mil. This bacterium was beta hemolytic on sheep blood alcohol. So first of all, just sit there for a moment and appreciate how much of this you understand just from taking this course, right? Because you all have got a little bit more clinical knowledge now than you had before you walked into this course. And it's just gonna keep developing. Every year or every semester that you're in your program, you're just gonna get smarter and smarter and smarter. Okay? So, what do you notice? Tell me what you notice here. Because you'll have some images. I think I put 3 images in for each case study. What do you notice here? Gram-negative rod. What do you notice here?
Where?
Here. It's McConkey. What do you notice? Lactose fermenter. What else do you notice? Huh?
The bio.
No, not here. Here's the bioprecipitate. Helpful, right? And then it's beta hemolytic. Okay, so now let's answer the question. So, what did your analysis indicate? They've got a urinary tract infection, right? So explain your answer. Well, they have white blood cells. White blood cells are all going to show up when you have bacteria. Probably should say neutrophils, right? It's got red blood cells and it's got bacteria in the urine, right? It's clean catch. Does everybody know what that means? Clean catch.
Mm-hmm.
Who doesn't know what clean catch means? You're not gonna. Okay, clean catch means when we think that there's a urinary tract infection. If you start to urinate in a cup, you're gonna get all the organisms that are in the opening of the urethra, and that's gonna complicate our ability to analyze what's going on. A good microbiologist can look at it and say, this is not clean catch, and I don't care about any of these organisms. However, there's a few in here that are important, and they're in numbers that I believe that are important. You can pick them apart, but a lot of people can't do that. So we say we want a midstream or a clean catch, and what that means is that you start to urinate and then you collect. Nowadays, the collection of the sample is so complicated. You're supposed to wipe the opening urethra, start to urinate, stop, try to stop when you urinate.
It's hard.
Then you clean it again, then you start to then you collect. To me, it's just good enough to start to urinate, count to 2, 1001, 1002, and then just collect. That's a clean catch or a midstream urine sample. Okay? So, the bacterium responsible for the infection is the most common cause of UTIs. What's a pathogen? Easy. The urinary isolate was indole positive. How does this information help you with identification? Now you have to rely on lab. and I said this several times in lab, indol is a very powerful tool, especially for E. coli, because 99.9% of all E. coli are indol positive. Okay? Why are urinary tract infections more frequent in women than in men? Shorter urethra and the proximal distance to the open urethra to the anus. Okay? Did this patient have cystitis or pyelonephritis? Can I go what? Up symptoms? Yeah. Left flank pain and costovertebral ankle tenderness. It's pyelonephritis, right? Why is it important to differentiate the two? Kidneys are much worse, so we treat them much more aggressively because there can be a lot more negative outcomes with the kidney. Okay? This is an example of a case study.
Could you be kind enough to put a case study on Blackboard so I can practice? So,
I can't, because they'll end up on the cheater site, and then I can't use them anymore.
oh,
I'll tell you what, since two people asked, I'll put this one on.
okay, just so I can highlight.
This is my example, right? But it's real easy. I don't really give it any time. In most long semesters, if we do a project, we didn't do a project this semester, we have the 5th exam is half case studies and half multiple choice. But because we didn't do a project this time, then we're gonna have 2 case studies and 1 multiple choice on exam 5, and then people who wanna take the final. And Harlow, you weren't here, but I said that the questions that were put together were pretty good except for 2 of them. I knocked those out, but the others I just edited, and so there'll be two different exams. One of them, if I have a list of people who I think participated, I have to check with Harlow. And then you'll get the part that has the questions. If you wanna take the exam and didn't participate in writing the questions, you'll get another version of the exam that aren't gonna have any of these questions that were written by you all. There were like, I don't know, 12 of you all participated. That's good. Okay? Anybody have questions?
If I don't have to take my final test, can I give that test to someone else?
If you what?
So let's say I participate in writing questions. If I don't have to take that exam, if I feel like I'm good, can I give it to someone else?
No.
Alright.
It's not fair for people to not have contributed and then to benefit from it.
Okay.
Okay? Anybody else have questions? So, is Adati the only person that needs to talk to me? Anybody else? Okay. Everybody else have a good, whatever, day, afternoon,